Hi, quickly about three important pain-relieving drugs or analgesics and what are the limitations. First one is a very commonly used drug, acetaminophen, paracetamol or Tylenol that we call it as. Now, it is considered to be a very safe drug, but especially people who have some liver disorder and they are taking this paracetamol or acetaminophen can aggravate the liver issues. Alcoholics should not be taking too much of paracetamol or acetaminophen because again it can cause hepatocellular damage. The second one is ibuprofen. Now, ibuprofen is a very good anti-inflammatory as well as an analgesic. But if you use it excessively, it can lead to stomach irritation, can increase the risk of gastric bleeding, and prolonged use of analgesics can lead to kidney damage called as nephropathy. Now, the third group, which is a very strong analgesics, are opioids. They're not available over the counter because they have a high risk of dependence. And if you overuse them or abuse them, it can lead to respiratory depression.